Hi, my name is Brittany Kressler, and I am going to be talking about how I used clinical judgment while caring for a patient with end-of-life care. I'm going to talk about how I used the clinical judgment model and how I did that to help support both the patient and the family. So, recognizing and analyzing cues. So my patient had end-stage cancer and was placed on hospice care. So I noticed that the patient was showing signs of excessive sleepiness, shallow breathing, less interest in eating and drinking. So the family was obviously extra concerned because obviously, why wouldn't you be? They weren't exactly sure what to expect. So these cues told me that the patient was obviously nearing the end of life, and the patient and the family both needed some extra physical comfort and emotional support, especially the family, because it seems like most of the time they are the ones who are struggling the most with the patient passing. So prioritizing hypotheses and generating solutions. So I prioritized comfort, dignity, and family education. So pain control obviously was at the top of the list. So my patient was having some pain. I noticed some nonverbal cues that he was in pain. He seemed a little restless. So I considered things like giving him extra pain medicine, repositioning him, making sure that his mouth was moist by using a mouth swab, and making sure that the family knew exactly what was happening. Because if the family is unsure of what's happening, then they're not providing the emotional support that they need to be to the patient. So you need to also support their emotional and cultural needs as well. So taking action and evaluating outcomes. So like I said, giving the pain medication as ordered, repositioning the patient every 2 hours, using mouth swabs to prevent dryness, answering any of the patient's family members' questions, contacting the hospice nurse if you need any extra support. The patient appeared like he was a little bit more peaceful after getting that extra medication. And the family seemed like they understood that it was nearing the end of life, and they kind of knew what more to expect. So it wasn't really a surprise for them. So I felt like the care that I gave them, both, all, really was quality care because they really understood what was happening. Everyone understood what was happening. Everyone was on the same page. And they got to experience the end of life with the patient comfortable, and the patient got to have dignity as he passed. The experience helped me understand end-of-life care is more than just physical needs. So there's emotional needs for both the patient and the family member. The clinical judgment model helped me guide my thinking and helped me remember that there's a powerful presence and compassion in nursing, and you need to make sure that you are doing everything you can for the patient and their family. And that is all I have. Thank you.